Hello, class 631 Nursing Research. My name is Blair Mayu, and this is my grant funding presentation on my evidence-based project, Nurse-Led Interventions to Address Food Insecurity in Families with Children. Today, the United States Department of Agriculture describes food insecurity as unpredictability or the restricted availability for nutritional sufficient standards of healthy and safe food, or the restricted or unpredictability to gain access to safe and nutritional food, with an approach that society labels as acceptable. In the 1960s, the U.S. hunger and food accessibility was recognized as a result from poverty, so the federal government began to implement programs to address the challenges of assessing food in the nation. As the economy was challenged in the 1980s, the government and researchers narrowed down definitions and concepts of food insecurity and hunger, the populations affected, and the measures to appropriately determine who is at risk for food insecurity. In the 1990s, the nation had a turning point and put into law the National Nutritional Monitoring and Related Research Act that clearly defined the terminology and concepts related to and around food insecurity within the country. The significance of food insecurity reaches the lives of more than 10% of families with children for some or part of the year, and sadly a good portion of the 10% of families face larger struggles with food that sacrifices sufficient intake of food because they don't have any other options. Coleman et al. 2020 reports that in 2019, the significance of food insecurity reached in the homes of 10.5 families that claimed they were with less food for at least during some or parts of the year, and of that 10.5%, 3.9 were very low insecure, which meant that they had to change their entire eating habits as a result to lack of food resources and financial stability to access food. Furthermore, to complicate the issue, the current United States food stockpile is diverse, and although it does have the potential to offer nutritious food for positive health outcomes, it isn't always available in both quality or quantity to adequately meet the needs of many families, children, and individuals from coast to coast. And the future of national food insecurity rate is projected to be as high as 20%. The purpose of this evidence-based project is to identify the most recent evidence to support the identification of children and communities at risk for food insecurity and to mitigate risk factors. This project will initiate a food insecurity tool that will be the first step in leading concerned nurses to address and relieve food insecurity as a challenging and complex social determinant of health. Let's take a closer look at why awarding this project with this grant is vital to this community. One weekend, while caring for a sick infant, I watched the parents who were boarding in the room with the child open a camping cooler that they had brought with them and noticed the overflow in it of hospital food from the days before. When it came down to discharge this patient, a more senior nurse took me aside and said, "Go to the closet of donations. There are non-perishable food items in there that I always donate to families when they look to be struggling to purchase food." There is a gap in knowledge in the nurses who struggle to work on this unit, as we have concerned about our patients who might be suffering from food insecurity, and without any screening tools or resources for them, there might be countless children that we are returning back into these communities without any help whatsoever at discharge, and that's unhealthy for the child. Therefore, the pediatric nurses that serve this community, like myself, began wondering, what is the percentage of our patients from the surrounding community that actually suffer from food insecurity, and could we do anything to help them? This project aims at closing the gap and addressing the lack of screening tools within a community hospital that serves a population who are actually at risk for food insecurity. A food insecurity screening tool is the first step needed to help concerned nurses to relieve and address their patients and families. To gain a perspective of the importance of this project, I'd like you to take a look at the national, county, and state percentages of food insecurity. According to Feeding America in 2021, in 2019, the U.S. national food insecurity rate is 14.6. And the state of Massachusetts is at 8.9, and Bristol County is above that national average at 12.9. The design of the study is exploratory, descriptive, quantitative. And from the findings of the literature review, the decision was made to implement the gold standard for screening for food insecurity, which is called the Hunger Vital Sign, which is a 2-item questionnaire, and we are going to use that as the nurse-led intervention. The Hunger Vital Sign tool provides the responder with 2 questions regarding food quality and quantity within the past year in a household, and it uses a Likert scale for responses to rate their experience of food insecurity. This survey will be given to a purposive sample of willing participants that meet the inclusion criteria for our study in the community hospital within the pediatric unit, and there will be a total of 30 participants. The project aims at closing the gap, addressing the lack of screening tools within a community hospital that serves a population who is at risk. A food insecurity tool is the first step in identifying how to help families in this community. This project implemented a conceptual framework to visualize the relationships of the concepts of food insecurity, as it is a challenging and complex social determinants of health, and factors related are individualized socioeconomic status, accessibility, and public policy. According to the literature review, the more families struggle, the more at risk children are for childhood adversity, and that leads to increased poor health outcomes, which leads to an increase in healthcare costs on the healthcare system, a lower quality of life for families, and it inflates the social determinants of health within the community. Screening is a vital tool that starts off as a collaborative intervention, such as public policies, community advocates, and political will and healthcare organizations to address food insecurity in this community. All is vital in narrowing the complex social determinants of health. Why is this study significant to the field of nursing? Nurse-led and healthcare-led interventions include not only screenings, identifying, advocating for public policy and new approaches, but also nursing fundamentals, such as promoting healthy environments to promote well-being and growth. Nightingale's environmental theory suggests several key components to healthy environments: ventilation, fresh air, lighting, direct sunlight, hydration, and nutrition. This strong emphasis around providing a consistent, healthy, and nurturing environment is especially true for children because they're more likely to become sicker much faster than adults, which highlights this vital component of environment with nutritious food for a child's health. When I think of innovation, I think of why I became a nurse, to make a difference. We are not only nurses who care for others, but nurses that welcomes our role as innovators, educators of health, medicine, and well-being, and advocates for helping the vulnerable by lowering social determinants of health. Here is a TED Talk about nurses in healthcare that inspired me to always challenge when I see something wrong in nursing. References in this video are on my last slide. Enjoy.
Florence Nightingale gave a quote in which she said, "If there were none in the world who were discontented, the world would never reach anything better." And what that means is in moments of great challenge, there is opportunity for great change. Innovation is the moment between stagnation and progress. Innovation is the impossible, the unbelievable, the unattainable, until it is the possible, the attainable, the believable. Don't let anyone ever tell you that it can't be done, because it simply just hasn't yet been done. If you see something wrong in nursing, change it.
So I ask you to help me tackle this first step in change and grant my program. Why? If not for the fact that these tiny humans determine our future, but also because of my conclusion of the empirical literature that I reviewed for this study that finds these tiny humans in our community need it. Half of the articles were combined of systematic reviews that all included evidence suggesting the long-term negative effects of children living in a home with food insecurity. The remaining half explored the lived experiences of food insecurity among several roles involved, as well as government-funded research report on the nation's food insecurity problem. Interestingly, adverse health outcomes related to food insecurity in children is a common theme in 3 of the systematic reviews. Spoad et al. In 2021 systematic review examined the association between malnutrition and its role in negative pediatric health outcomes and found that children who grew up with food insecurity issues can potentially place them at risk for certain diseases and social issues in their entire lifetime. Some of the most interesting and vital information in the systematic reviews chosen in this literature review stem from Shankar et al.'s 2017 research on mitigation solutions, and their conclusion was the problem is not lack of research, but that it is a failure of public policies and political will to address the complexity public health threats of social determinants of health, such as food insecurity. This conclusion is actually shared with Gunagarnis et al. 2021's exploratory descriptive findings on the perspectives of food bank stakeholders' opinions and healthcare systems of today, and the status of them collaborating with discussions about food banking and healthcare organizations, which shows the collaboration of public policy and healthcare systems is a necessary change to successfully address food insecurity in our nation. Thank you for taking the time today to be here and listen to my grant proposal. And if you have any questions about my study findings, please feel free to email me. And here is a list of my references. If you should need that, email me and I will get you anything you need. Thank you and have a great day.